In the last video, we heard from Jjay Health Services, which is an health insurance company, their particular data need, and how that they are hiring you as a data consultant to be able to solve their data problem. But you need to back off. You don't just jump right into analysis. You don't just, oh yeah, let's get into it. In fact, one of the good or great indicator of a data analysis that knows their stuff is that they would ask questions. So you want to be able to think about or process what the stakeholder has said and what are the kind of questions that would ask them in this type of scenario. And I didn't just want you to focus on the questions that I would, that we're asking the stakeholder right now. I want you to think about the art of it, the ART. So what you can do is that probably after like your watch this particular video, go back again to the first video, which is like the 2.1, to try to see, oh, okay, so this was like what happened, and this was like the kind of question that we asked them. So, but to make things a little bit easier, this was like an overview of like the problem statement that the CEO and the CFO of the organization, the stakeholders of GHS, health services like had. So one of them was that they said they had a drastic increase in total claim costs. So one question that we can ask, which I put in the yellow highlights, is what was the initial cost over the last 2 years? So they need to have like a benchmark. So what was like were they tracking it before? Were they just like having we think this cost is increasing? There has to be like a data that we are using to track that. So that's one of the things you want to ask the stakeholder in this sense. And you're like, oh, this is sounding like a normal common sense kind of question. Yeah, majority of what we do, as data experts, first of all, stand up from common sense, but it's more than common sense. So the next thing also is they spoke about that they noticed an increased inpatient admission among Medicare Advantage members. So the next thing we need to know is that do they have information on inpatient, right? Do they have like a data that shows that okay, this patient is inpatient, right? Like maybe they went to the office or doctor. So you're like, oh, and probably the answer is like, oh yeah, we do have information related to that. So also, do we have a way to be able to know if somebody is Medicare Advantage member? Because all their members are Medicare Advantage member. Like maybe they don't have marketplace. And in case you are wondering what is marketplace, so marketplace is the insurance that you buy by yourself, right? Or also some ones that the employer does is also like under marketplace, but like you go shop, the government doesn't pay for you. That might also qualify as a marketplace insurance. So they also spoke about that they have higher than expected admission rates in certain regions. The next question you want to ask is that how do you define regions? Is it based off of zip code, state, county? Like that's one of the things you want to like really ask and be sure about. There is also like the issue that they had about growing provider payment disputes. So they need to be able to know, is there a way we want to measure it? How do we know? Do you have an information that says, okay, maybe is it because you denied a claim? That's when you're saying there's a dispute, or is because of ESAs from your stakeholder? So we need to know if we have this. So, and most likely the response of the or what you're going to ask to do, you're going to ask to request for some data, and we're going to talk about like, and sometimes stakeholder knows, okay, they're just going to probably give you a bunch of data sets. When they give you those data sets, you're like, okay, this is what I want, or do you guys have more information? You're trying to understand their data way because you don't work for them. And they also have executive difficulty obtaining consistent reliable performance dashboard. So you're like, okay, yeah, we'll try to work on something, and you're having like more context. They also spoke about like escalating like medical loss ratio. And one of the things you want to ask them is, how is medical loss ratio measured? Yeah, because you're like, because one thing about like when you're working on data analysis now, which is fine, you're going to have to get some terms that you're not familiar with. So you need to ask the business because they know like the technicality of what they are explaining. So they explain to you in normal lane terms. So there's nothing wrong with asking question, oh, what is the medical loss ratio? And I'm not going to talk about medical loss ratio right now. I'm going to talk about that in the other video. So you need to ask what that means. What that means, right? Spoke about regional cost variability. Like, okay, that sounds like something we can do. They also say that the high cost members driving disproportionate spending. Maybe there are some members that they are spending more money, like maybe for a particular member, maybe they spend like almost $1 million on claims. Maybe this member usually falls sick. So how do you define a member is like spending more money? Is it based off of the top 5% of people that we are spending more money, or there's a fixed dollar amount? You're like, okay, these people are paying us maybe $10,000 per month, and in a year that's $120, 120,000, right? So if if these members, we are going to, you know, like think about them as not being expensive. We don't want to spend more than 80,000 on every member. So any member we spend more than 80,000 more on, is like, it's probably like very high. So you need to ask what that is, right? And sometimes they might not know. So you have to also think about like the various back and forth, and you might give, okay, I think let's try this out, or this is a good indicator, and all like that. So the other question they have is also readmission and preventable utilization. So what qualifies as readmission in their internal definition? Is it like when somebody comes back within 30 days, or they go to the same facility, or they come back with the same issue? So all of those. So that's why you need to understand context of healthcare to be able to know the right questions to ask. So you don't just want go make assumption, because you're like, okay, so you're like, oh, I'm trying to do analysis on readmission. What does that mean? So they also have a question on payer provider contract performance. So one other question you could ask is, are provider reimbursed fee for service or value-based contract? That's a whole conversation. Like, do they say, okay, for every service they make, they'll pay, or like it's a value-based contract and all that? So other questions that could also be asked is length of stay measured in calendar days or midnight stay, right? Now somebody stays like, so there's midnight, there's one day, that's if you stay one midnight, that's just one night. It's based off of, okay, Monday and Tuesday, right? Or just Monday, Tuesday is one day. So that's how you want to, like, you want to ask that. So how are adjustment categorized? Is it contractual or administrative? This, I'm just giving you a possible question just to have more context about like the LKA. There's also like what is considered an encounter in the data set. Is it like at the claim line, the claim header, or visit level aggregation? Don't worry, when we get into the data set, you're going to understand the difference between the claim line, claim header, and visit level aggregation. Then also is also what's the KPI, or the key performance index, that keeps the CEO up at night right now. So that's one of the questions. This is just to get more context and explain in a better way their issues. Is the primary concern cost control, profitability, compliance, or network performance, right? Are you guys trying to increase more profits by getting more member, or you are trying to reduce costs? And it seems as though they are trying to reduce costs in this scenario based of the conversation. And one other thing is also is that what's the single most urgent decision this analysis must support? So you can ask the same question multiple ways, and it's not bad as a data expert. You also want to ask, are rising costs driven by utilization, volume, or price per service? They might not know this answer. You're like, okay, don't worry, I'm going to check this out myself. Do we have quality metrics tied to reimbursement, right? These are also questions you could ask. Do we have risk scores available? So maybe you have EDIS risk scores. So I'm mentioning some things right now, and I'm going to give like a reference for reading so you can have more better data, better understanding of what we want to do. Are chronic conditions flagged in the data? So the summary of this is that a good data analyst asks this same question twice, but in a different way. And the first video we spoke about like the problem that they had, and these are the kind of questions that we can ask them. So most of the time it's going to be a lot of like back and forth before you even jump right into the analysis. And in the next video we want to look at the data set right now. So after this, JHS has given us the problem. We will ask them some questions. We're like, okay, let's even see the data. Let's see the data, and after seeing the data, we can then try to jump into like analysis. But before we even jump into analysis, there are still few things we need to do. So see you in the next video when we start to explore the data set. Bye.